There we go. Hello, everyone. Dr. Martin Braun here from Vancouver, British Columbia, Canada, the Great White North. It's raining outside, and thank you very much for joining me. And I will also like to thank Induction Therapies for sponsoring this webinar on TRUExosomes. And I'd like to share with you some of my clinical experience as well as my feeling about exosomes, which are all the rage right now. And so we called this webinar The Truth About Exosomes. Here are my disclosures. I speak for various companies. I've been doing aesthetic medicine now for 30 years. I was the first doctor to bring laser hair removal, for example, to Canada in the last century. So I've been at this for quite a while. Um, I have a personal interest in regenerative medicine because I have lousy knees from multiple ski injuries over the years. And so I've had autologous stem cell deployments as well as various exosomes injected into my knees, as well as systemically over the last few years in order to alleviate knee pain and allow me to continue to ski. And so these are some pictures here where I was in Korea at the RAES conference, the Regenerative Aesthetic Exosome Summit. This one in particular was the 10th annual RAES summit in Seoul, Korea. So for the Koreans, this is old hat. They've been doing this for quite a while right now. For us, it's more relatively new. But in Asia, they're at the forefront of regenerative medicine, using both stem cells, amniotic cells, umbilical cells, anything from the placenta, as well as various exosome products. And we'll talk about that. And that's why Korean skincare is right now at the forefront and all the rage as well, if you look at social media. And they call it Korea where glass skin is born. And the glass skin Korean facial is basically doing an exosome treatment with or without salmon DNA. In a nutshell, and it's all the rage over there, of course. And for us, as I said, it's relatively new, but not for them. So why all this hype about exosomes over here in the West? Well, we're finally discussing it in the fashion magazines such as Elle right here. This article is from April 2024, so about 18 months old. And is this the next frontier in aesthetics? And we get all kinds of headlines. I'm going back a year or two. Is this going to be bigger than Botox due to the anti-inflammatory and the regenerative capabilities of exosomes? And we can see here a quote from Dr. Williams, president of the American Society of Plastic Surgery. Could this be bigger than Botox? And is it the holy grail of anti-aging? And so we see it also on realself.com as well. Is it the next biggest thing in aesthetics? And how can exosomes enhance your cosmetic results with the current treatments that you're doing? And it's considered one of the biggest trends last year in 2024. And, it helps with recovery as well as enhance your results. And why all this media interest? Well, it just takes one big celebrity like Kim Kardashian to talk about her exosome treatments, and then her 400 million followers hear about it, as you can see here. And so, what are exosomes in a nutshell? We hear this term, used very loosely. Exosomes are simply a type of extracellular vesicle. Okay. And so they've been defined by various sizes, but 35 to 150 nanometers seems to be about the consensus right now for exosomes. But extracellular vesicles come in all kinds of sizes, but it's basically the smaller ones that are considered exosomes. And an exosomes is simply an envelope. So think of it as when you mail a letter, you have to have an envelope. Now, what are the contents of the envelope? Are what are inside the exosome. And so this is simply a way for cells to talk with each other, and they send little packages. So if you look at this diagram right here, you can see all kinds of extracellular vesicles, and they use different names. Even the names aren't all in agreement, such as microvesicles, exosome-like vesicles, exosomes, of course, and membrane particles. And this screenshot from one of the articles in the literature, they define exosomes here as 50 to 100 nanometers rather than 35 to 150. So there isn't even complete agreement as to what is the exact definition of an exosome. But in general, most people say 35 to 150 nanometer particles, larger ones called microvesicles. So there you can see the exosomes right here as a little bleb from the inside of the membrane. Now, what's interesting is some of these microvesicles actually are made by the bilipid membrane of the cell, like a microvesicle. An exosome, by definition, comes from the endoplasmic reticulum, the inside of the cell lining. So, the history of exosomes, well, extracellular vesicles were first described in 1967 in developing cartilage, and then further examination of these different vesicles led to the term exosomes in 1981. So, it's been almost 50 years that we've known about these things, and so now we're using them in aesthetic medicine as well as other applications. Now, to give you some context about size, there you can see an exosome particle at roughly 100 nanometers, and there's a lipid particle similar in size, and there's a virus particle. Okay, so an exosome can be anywhere from 2 times the size of a virus particle to 7 times, 8 times its size. And there's an antibody with a bisulfide bridge you can see there. So this gives you an idea how tiny these exosomes really are in comparison to other particles in mammals. And so here you can see a summary of what I just said, that they're basically extracellular particles secreted by our cells, specifically stem cells in this case, and they're essential for intercellular communication. That's how cells talk to each other. And the package contains mainly messenger RNA, different peptides, which can be cytokines, growth factors, interleukins, whatever you want to call them, that one cell has decided to send to another cell in order to communicate a message. Okay, there is generally no DNA in an exosome. It doesn't have a nucleus, therefore, it cannot self replicate. And that's why the regulators are not up in arms about exosomes. In North America, they do have difficulty accepting stem cells, as we all know. And, those are essentially like semi-forbidden, I would say. But although other areas of the world, like throughout Mexico, the Caribbean, Panama, do stem cell deployments all the time. So if we look at an exosome and the bilipid membrane that is on the exosome, it obviously contains different proteins, which are signaling molecules for the other cells. So you can see it gets very, very complicated quickly on what kind of proteins are on the exosome. For example, a very common one is called CD63, and it's one method of measuring the exosome content in a given solution. You can look at what kind of particles are on the surface. And there are all kinds of particles, as you can see, and the citation is down below there if you're interested in reading more about this. So where do exosomes come from? Of course, this is very important, and the sources can be broken down very simply. Is the exosome, like what living thing did the exosome come from? Is it an animal? Is it a plant? Or is it a human? And so our regulators do have some problems with human exosomes because of prions and other transmissible diseases. There's concern that it may be passed on, although the companies that make human exosomes try to have a very good cell bank, from humans that have been vetted out, very carefully. However, if you go to plants, you don't have these issues whatsoever. Also, with animals, animals can carry things like look at cows, for example, got bungiform encephalopathy, otherwise known as Jakob-Creutzfeldt disease. Remember, there was that problem banning British beef there for a while, and I was forbidden to give blood in Canada because actually, when I went to donate once, they asked me, how much time have I spent in Great Britain in the last 5 years? And I said, I don't know, maybe 6 months in total. I love going to London, England. And because of that, I was disqualified for giving blood in Canada because maybe I've got Jakob-Creutzfeldt disease and that accounts for my declining mental state. I don't know. It could just be the age syndrome as well. But anyway, here I am, and there's over 50 million people in Britain. They all seem to do well despite eating hamburger. But anyway, these are the concerns that people have, and you avoid all this if you have a plant source, of course. And there are some companies, I should mention as well, that are now making synthetic exosomes. Well, they are making a bilipid membrane, like a liposome, literally, and packaging it with what they feel are appropriate growth factors. Now, it takes a lot of hubris to think that we know everything that the animal and plant kingdom know to package in there. And, but the synthetic ones are being made. So if you look at just plant-derived exosomes, what are the advantages? Well, we know that the cells talk to each other in plants, obviously. It's a living thing that is growing. They have a lipid membrane, which protects the cargo, just like a mammalian derived exosome. They pass through all kinds of barriers in humans. When we eat plants, plants have exosomes in them, obviously, and we absorb these plants and exosomes in our GI tract, and they go throughout our body. Our immune system tolerates these plants, and so this is a very suitable aesthetic application source with easy availability, and they're not toxic and they store very well. Hence, that's why we have plant-derived exosomes. And there are many advantages over an animal-derived exosome that may or may not be detected by the immune system. And the plant ones have very high bioavailability. This has been shown compared to simply unpackaged messenger RNA. Proven stability in our GI tract. It targets specific organs, including the brain, and has high permeation through various barriers. And the article down there from 2022 is cited if you'd like to read more about plant-derived exosomes yourself. So if you look at this in a diagrammatic portion, system, you can see you can pick various plants as your source, and then you want to extract the exosomes from the plant. And so this is a process that has to be done very well, and we'll talk about that on the ensuing slides. And these exosomes will contain all kinds of different messengers, as you can see there. Different proteins, enzymes, messenger RNA, bioactive compounds that the plant wants to communicate with another cell. So, how do they make plant-based exosomes? How are these things made? Well, you start with the plant. Now, some companies just simply mush it all up and make a smoothie and call it an exosome. So that's what happens when you take your kale or spinach and put it in your, smoothie maker, whichever thing you're using. However, the proper way to do this is to start a centrifugation process. And so you use various centrifuges, including ultracentrifugation, and then you filter it as well. And then you ultimately will extract an exosome product. Now you can imagine in order to go from a plant like a watermelon all the way down to a 35 nanometer particle will require some work and it has to be done well. So all exosomes are not created equally. And so when you look at this again, like here, you can see that there's a multi-step process involved in order to make a quality exosome. So therefore, the manufacturing process is critical. So you should always ask wherever you're getting your exosomes from, for example, do you have a GMP facility? Is a good manufacturing process facility? Has it been inspected by the FDA? That's a fair question. And what are the sources of the plants? Like, are they organically grown? Like, that's a good question to ask. If you're using animal-based exosomes, is it an isolated herd of cows, for example? Because you don't want any viruses introduced into it. If you're using an apple-based exosome, where's the orchard? Like, has it been around for a while? So the source is critical, how they isolate the exosomes. Now, how do they concentrate them? How do they purify them? And then ultimately, is there any clinical efficacy or viability of these things? Have they been destroyed in the manufacturing process? And so because of these concerns, there are now a variety of agencies that are developing, of course, to try to get some standardization in the exosome field, like this International Society for Extracellular Vesicles and the European network right there, because they'd like to have standard operating protocols, processing testing, so that we have some way of regulating this burgeoning field of exosomes. So I wanted to look at what data exists on exosomes for aesthetic applications. So I found this great article by Pinto et al. In Aesthetic Plastic Surgery. And at the time, they found almost 17,000 articles on exosomes since 1986 in the last 9 years. Most of them were written for aesthetic purposes. These are the ones that were vetted for aesthetics, as you can see here in this graph, since 2016, sorry, right there. And so they looked at this and vetted out of 17,000 articles, they came up with 339 that met their aesthetic review criteria. And they looked for terms such as aesthetic dermatology. You can see there on the right, platelet-rich plasma, that kind of thing. Some people mix it with PRP, for example. And so they continued to weed down the articles with very stringent debugging, and they finally ended up with only nine articles in all in 2023 that they felt were good studies on humans. And you can see them right there, like one on skin brightening, one on tissue regeneration. So there obviously much more research has to be done on exosomes in aesthetic applications. And so this is a great little article right here because there is a lot of research being done on the bench. And this one compared, for example, ginseng to green tea. And it's very interesting here. These are metalloproteinase, and this was actually elastase, so breaking down elastin. And so you want to have those graphs go down. So if you look at the one in the top left, for example, I'll zoom in on it right now, right here on aging, because that's one that I'm very interested in. You have a control group, and there you can see that the elastase activity actually went up with ginseng extract, but dropped precipitously with ginseng exosomes. So just having a purified bit of ginseng doesn't seem to be nearly as good as having some ginseng exosomes. Green tea, there was hardly any difference in elastase activity. So it doesn't really matter whether you probably drink your green tea or have green tea exosomes for as far as elastase activity goes. So these are very interesting little studies done in the test tube. And so we attempt to extrapolate some of this into the living organism, i.e., human skin. So it begs the question, which exosome should I use? We have a large variety, and this is just one screenshot of some of the exosome companies that are out there. It's literally mind-boggling, the number of exosome companies that are out there right now. But once again, you want to ask yourself, are there good manufacturing processes, and where did the exosomes come from? So that next begs the question, how am I going to deliver these exosomes into my patients? And I'm primarily interested in the scalp for good scalp health and hair growth, as well as anti-aging and regenerative properties. So, how do we use exosomes in our practice? Microneedling, which I now use the term microchanneling, because we used to do microneedling, and the old teaching was you got to draw blood. Okay. And so the deeper you go, the better. And I feel this is no longer the case in 2025 because we have these fertilizers, these kind of skin boosters, people use that term, like the exosomes, that we don't have to go as deep. We don't have to hurt our patients because the deeper you go, the more it hurts, obviously. And so in my practice, we will generally treat the forehead at zero point 0.2 to zero point 0.3 millimeters and the rest of the face at zero point 0.5 and for the average person. So unless there are indications such as acne, scarring, deep wrinkles, we find it's not necessary to go deep. Now, some people would challenge this, but I find the deeper you go, it simply hurts more, the patient's more red, and you get more bleeding, obviously, because you're cutting more vessels once you get deeper in the dermis. So you can see this diagram right there that at our basement membrane in a typical human is about zero point 0.3 millimeters. So anything deeper than zero point 0.3, you're into the dermis. So you've made the channel in order to deliver whatever product you would like to deliver, even if it's simply hyaluronic acid. And so I don't believe it's necessary personally to go that deep the way we used to with our microneedling devices. Now you may ask, why microneedling? Well, it's inexpensive compared to a fractional laser or an RF microneedling device. Not that there's anything wrong with those. There you get the benefit of heat, but microneedling is a fraction of the cost to deliver the service to the patient. And it's been studied for decades right now. And microneedling can treat virtually any condition that we have, as you can see right there with this list. I don't know if there's anything left that one could treat on that slide right here. Everything from scarring, pigmentation, pores, rosacea, scars, stretch marks, everything. So I'm trying to make microneedling great again. And the way we're going to do that is add some exosomes to the process. And there we can see you can get a nice MAGA hat. And for those of you that want to feel that I'm inclusive, we also have the blue hat as well. Okay. So don't take offense with the red hat. So, what was the first microneedling device that was approved by the FDA? Well, it was called the skin pen, and that was only 9 years ago. And it was approved specifically for acne scars. And of course, it's used for literally everything on that preceding slide. And if you look at the specs of this pen, it's 7,200 RPMs. There's 14 needles in the needle cartridge. Well, if you do the math there, you're going to get 1680 perforations per second. Okay, that's a lot of perforations. So then along came the Derma pen, which is another very common pen, and they improved on the skin pen by putting 16 needles in, and it's hooked up to an iPhone. And now you have 1,866 perforations per second if you do the math. So along came the collagen pen, which interested me immensely. It was approved most recently in October 2022, and it has 9,000 RPMs and it has 36 needles. So that's substantially more needles than the skin pen or the DP4. And if you do the math, 9,000 RPM, okay, that's 150 per second times 36, we get 5,400 RPMs, which is literally triple the speed of the DP4 or the skin pen. So it's very, very fast. And what does this mean for your practice? Well, whatever you're doing right now with the competitor's pen, you can do 3 times as fast with this one. So if you're treating someone for 3 minutes, you only got to do it for 1 minute for this one, unless you want to make 3 times the channeling. And what does it look like? Well, there's 36 needles on the left of your screen, and there's 14 needles, like a skin pen, for example, on the right. So you can see the difference. So it's basically more needles, more channels, more power, more collagen. And so I like that. And so 36 needles, you can work very, very quickly with this device. Very, very quickly. So basically, we've got 3 times the speed so than what you're used to. And I find that people who've used other pens, for microneedling, have to really understand that if they do the same thing they were doing before with the same speed or the same number of passes, well, they're getting 3 times the efficacy with this one. So, how to use the exosomes? Well, we're going to make tiny channels and use the exosomes as basically a lubricant on the skin. We can use just plain hyaluronic acid, or we can use these things as a skin booster. We are not permitted to inject them, that's disallowed, but we are permitted to use them topically. And so induction therapies makes basically 2 exosomes, the plant-based exosomes. They've added copper tripeptide, which you all know is all the rage right now. People, in fact, are injecting, peptides from the peptide companies, including copper tripeptide. And it is in these plant-based exosomes as well, fortified with that. And the one on the right side of your screen, called PRX8, also has retinol in it. So if you would like to add retinol to your treatment, well, you have the choice of doing so. So they have plant-based exosomes with retinol and without retinol, and both of them contain the copper tripeptide, which is nice. So the good news is too, you can get this from your representative. A third party has analyzed their exosomes, looking for particles between the sizes of 35 and 150 nanometers. And this was not induction therapy, it's an independent lab. And they looked at 5 different exosome products, and a very interesting, 2 of them didn't have any 35 nanometer particles in them. And the induction therapies had a very high concentration, the highest of anyone measured. And so it's basically 5 trillion exosomes per mil. And so each of these bottles has 10 mils in them. So I find you need about 2.5 mils to adequately lubricate a face in order to do a proper microneedling treatment, microchanneling, I call it. And so you could technically do four people with one vial, or you could do one vial, one person, and send the rest home with them. You can do whatever you like. You can choose to use retinol or not use retinol, whatever you like. The retinol will give you a more fortified treatment, of course. So here's a picture of me getting RF microneedling. Um, this happens to be, I think, the silk firm that I'm using at the time too. And so I want to put it out to the group. How many of your patients would be willing to have a microneedling treatment, very superficial, after their toxin or their filler injectable treatment? And so this is what we're endeavoring to do in our office. We have a microneedling club so that I would like, in an ideal world, that every time a patient comes into my office that for an injectable, that they have a quick microneedling appointment. And if we stay superficial, they're not very red, it doesn't hurt, they don't have any downtime, and they're going to, have better looking skin, obviously. And so the other thing that I don't have a slide for, but that induction therapies has, they also have these really nice chemical peel pads that are 4% and 8% retinol. So if you don't want to do the microneedling, you can just wipe the face with the pad and you're getting a vitamin A peel with plant-based exosomes to mitigate any redness. And so you get some light exfoliation 72 hours later. So I simply ask the patient, do you mind being red on day 3 with a little bit of exfoliation on day 3 and 4? We can do a 4% or 8% retinol peel on you with or without microneedling. So my patient's experience with exosomes to improve outcomes. You can see here I have some split face pictures where you can see neurotoxin only 6 years ago, what she looked like, and now in 2024, 5 years later, by adding some of these skin boosters and doing some RF microneedling with exosomes, you can see the difference in the skin quality right there on the right side of your screen. So there we have a split face on a woman who's aged 5 years, and her appearance has improved over time. There's a close up, and you can see, look at the pore effacement and everything. Now, of course, she had an energy based treatment, but I believe it's also the boosting of the exosomes that have enhanced this treatment. And this is what I saw the Koreans doing over in Asia. Here's another lady, neurotoxin only, and now being given some energy based treatments with exosomes. Here we can see another patient as well over a 3-year period, and you can see the improvement in her skin when we add exosomes to the treatment with the energy. So you can do this with any device that you like that makes little channels in the skin. And there's a close-up as well, and you see the effacement in the wrinkles. And so neurotoxin alone, there's nothing wrong with that, but we're not making any collagen or elastin. Here's a younger female, neurotoxin alone, and then adding a RF microneedling with exosomes. You see the reduction in redness as well. Same thing here. Here we have a little bit of filler added as well, so you can see the improvement too. So my colleagues have some experience as well with plant-based exosomes. These are some pictures from induction therapies using the PRX8, the plant-based exosomes with retinol, just with microneedling. So you can see 5 days post, she's red because she had some retinol as well. And then you can see at 1 week post how nice the skin is looking. Here's another example, a more aggressive treatment, for deeper rhytids using the PRX. Beautiful results. Kind of thing you get with an energy-based treatment using fractional resurfacing at much greater cost. Here's another lady as well. You can see the improvement in the skin quality, the texture, the luminescence, the radiance, everything a week after microneedling and plant-based exosomes with retinol. So what I want to emphasize is that the future is bright with exosomes. Pharmaceutical companies will likely be using these as a drug delivery system, as you can see there, putting various cargoes in the exosomes. And they can use, and they'll probably be using plant-based exosomes in order to do this. And, the permutations and combinations are immense with all this. So I want to thank you for your attention, and we'll open it to questions right now. Thank you very much.
Perfect. Thank you, Dr. Braun. So we do have our first question, and it is, can exosomes be used in addition to home care routine, or are they just primarily used in in-office treatments?
We primarily use them for in-office treatments. Yes, they can be used for home care. The question is, how well do they cross the skin barrier without doing a microchanneling process? Now, what you can do is tell the patient to use one of those skin rollers and use it at home as well. People are also doing their own microneedling at home, but they have to be, very careful in terms of, disinfecting the skin. I don't want to see anybody getting infections or anything. There are various products where they're putting the exosomes in cream bases. I don't know how well they absorb, but I have seen clinically some decent results, doing this. I do believe some portion does cross the skin.
Beautiful. And just for those who are familiarized with the induction therapies portfolio, we do add them, like Dr. Braun was saying, to our 4 and 8% back bar peels. And those peels, the Plant Exosome 4 and 8%, they did start off in back bar, but they were so popular in back bar that we brought them to consumer grade strengths of 0.5 and 1%. And so what we do see is that it does mitigate that inflammation associated with a potent active like retinol. So, Dr. Braun, our next question is, can exosomes be used? Okay, no, that was the other one just then. Let's see. When used with RF microneedling, does the heat break down the exosome?
No, because we are applying them afterwards. You see, when we do the RF microneedling, we do the RF microneedling, good question. And then once we've made the channel, we rub in the exosomes. So
Beautiful.
the heat has already been delivered. Same with lasering. With microneedling, we can use the exosomes as a lubricant. When you do microneedling with the collagen pen, you must have a lubricant on the skin. And every company will sell you non-cross-linked hyaluronic acid as the lubricant. So you can substitute or add the exosomes to the non-cross-linked hyaluronic acid lubricant that you have on the skin. You cannot microneedle someone without some sort of lubricant gel on the skin because you'll just make a big mess. So
Right,
we have been for decades microneedling in hyaluronic acid. That's the basic solution that every company uses.
right. And so the next one is, have you had or seen success, I believe is what they're asking, for hair loss similar to how PRP is being used, and does it work?
I find that it's better than my own PRP. I've been, trying to keep my hair, obviously. This is the bridge over troubled waters, okay? And I find the exosomes are superior. I see that some clinics, because people still ask about PRP, obviously, for hair loss, they inject the PRP and then follow it up with a microneedling treatment to the scalp using the exosomes. It's been shown that microneedling alone helps the scalp. The general rule of thumb is that anything that's good for your face is also good for your scalp. So you can use PRP as an injectable in the scalp, followed by microneedling with the exosomes if you want to differentiate yourself from a provider who's simply giving PRP, which is a hit and miss. Who knows how good your platelet growth factors are, your serum compared to the next person.
Right, exactly. And so the next question we have is, are there any biopsy studies to show how much do these exosomes boost collagen percentile wise, with or without microneedling? So you've mentioned the
Yes,
microchannel. Without that
yes,
microchannel,
yes, because as far as I know, I have not seen any split face treatments or anything. It's also difficult to do because some people argue that when you are giving the exosome, you're going to have a field effect. So even if we were trying to do a split face, a split scalp, a split forehead study, having exosomes in one side of my forehead can affect perhaps the other side because they are envelopes that are sending out messages. So how local is the local effect? Now, in the petri dish, it has been shown unequivocally that exosomes will, stimulate fibroblasts, for example, to make more collagen, make more elastin, that kind of thing. So it is very difficult to show, I would say, in a split face trial, because how local, again, is the local effect. So if I put exosomes on the left side of my face, probably affecting the right side a little bit as well.
Right, they do travel. And so the next
Yeah,
one,
and that's what they're made to do.
right. And so the next one is, there's a lot of confusion about the official literature of the glow tox, the microneedling in conjunction with your
Right.
toxin filler. And so this attendee has asked, in what order do you do the tox first, or do you do the filler last, or what is it?
Yes. I mean, that's a good question. And I think in an ideal world, you would do the microneedling first so that you're not manipulating the skin around the butt. We have just the way the clinic works. Sometimes people have done their Botox. We're talking about the microneedling. They say, yeah, I'd like to do it right now. We do it immediately after their toxin, like a few minutes have gone by. Some people are more sensitive. They would like numbing cream applied. So, I mean, that takes a good 15, 20 minutes. By then, your toxin's all absorbed. I mean, in animal studies, for instance, if you give a mouse a lethal dose of toxin intraperitoneally, you probably have less than 10 minutes to rescue the mouse with antibodies. After that, it's done. The toxin is in the motor neurons. I find I have not told patients, don't lay down, don't touch the area, don't manipulate it. I've had people do everything to go from Bikram yoga onto planes, wearing bicycle and motorcycle helmets after treating the upper face. I have never seen a problem. I've never had anyone, where I could blame a brow drop, a lid ptosis on them manipulating it. I haven't seen it. And I did the most toxin in Canada when I was younger for, I think, a period of 13 years. So I would have been one of the biggest injectors of toxin in Canada. So I can brag I've extensive experience with toxin and I've not seen it. I think many of these are medical myths. Like we were told you can't bend down and go shoe shopping. That was in Vogue magazine. I mean, it's just ridiculous. And you can go shoe shopping after your Botox immediately.
I like the way you put that. And
Like
so,
it just, and like I say, and I've not seen in people we microneedled immediately after Botox that they've had an issue, with more complications. I've not seen it.
there's no, so if they want to do the toxin before, is that
Yes, yeah, I do it in
okay?
my office. And I suppose if you want to avoid that issue, do the microneedling first. And especially if they have numbing cream, if you can use numbing cream and go a little deeper, now you've got a numb patient, so the whole toxin experience will be more pleasant for them. You can view it that way too.
Right, absolutely. And so with PRX8, the one with retinol, we're using the power of the exosome to increase cell to cell communication, which helps mitigate that inflammation and lower chaos in the skin. But this attendee has asked, what benefits can we tell our patients that microneedling with exosomes has over the traditional hyaluronic acid microneedling?
Yeah, and that is great until we have, extensive clinical data with biopsies, like the other question that, was just asked. We really don't know exactly. But what I can tell you clinically with exosomes, especially when used with heat-based treatments or anything traumatic to the skin, there is far less, as you said, chaos. There is less redness, there's less swelling, there is less pain, there's less heat. I've experienced it myself. And I'm hoping that my 66-year-old fibroblasts now get a good kick in the butt and produce more collagen and elastin and hyaluronic acid and, all kinds of other things. And it just simply, we only have two things that we know of to stimulate our skin. We've been using heat and micro traumas for years, and now we have these skin boosters, these exosomes. Those are like, what else do we have in order to stimulate our skin? So I've always told people heat is your friend, unless you got extensive melasma, I suppose. And that other than that, we only have skin boosters like this, like retinol being one of the most extensively studied ones. Hence, that's why they put the retinol in with the plant-based exosomes. We're just trying to enhance collagen and elastin synthesis as well as all the other good things that our fibroblasts do.
Right, right. And so the next question is, and I think you covered this in your presentation, is combining exosomes with PRP.
Yes, yeah, the PRP we're permitted to inject. The exosomes we do the microchanneling. So now you have both. And you can see if you do a quick search, like on the internet or through social media, you'll see some clinics, the provider, boasting that in their clinic they do PRP injections followed by microneedling with, for example, exosomes, right? And that, so you're going to get a more enhanced treatment. And it's very easy to microneedle, especially with something with the speed of this collagen, pin. Like it takes literally, I don't know, 2 minutes, 1 minute. Like, I mean, that thing is so fast. It really is fast. It really, really is fast. And when we had the previous devices moving to this, it was initially a challenge for my staff to understand, like literally two passes, on the x-axis, the y-axis, and wow, like, you see, the micro perforations, the redness come up very quickly, and it's mitigated by the exosomes. The other thing I didn't mention, they also have an exosome mask, like many companies make exosome masks. So if you really want to enhance the experience, put on a mask afterwards and let the patient sit there for 15 to 20 minutes. I mean, that's really a bespoke treatment then when you put the mask on afterwards. So that's the other thing one can do too, or send them home with a mask. So if they feel irritated that evening or the next day, they can apply the mask. And because it's their mask, they can put it back in the pouch. There's so much liquid exosome in the induction therapy mask, like I've measured it. After putting the mask on my face, there's still 12 milliliters in the package. So they don't even have to put that much in. They're giving you lots of exosomes. Don't throw it out. Like pour it in a little container and keep applying it to your face. It's good stuff, that serum.
Right. That's what we always, when we train, if you don't finish it, fold it down or funnel it into a sample pod so that you can
Yes,
give that post care to them. And so
yes,
we have a
yep.
lot of collagen pin users in the attendees, and they really want to know, because I get asked this question a lot, but it does qualify as an off-label use of it here in the United States. And so the depth appropriate for hair and scalp rejuvenation.
Yes. Yeah. The $1 million question. I ask
Yeah.
everyone I meet what they're doing and show me your pictures because it's all over the map. And I feel like, especially with men, I mean, we seem to have a lower pain tolerance than women too. And I want the person to have frequent microneedling. Like, and hair loss is an ongoing phenomena. We're not curing anybody, we're treating them. And the sooner we treat them, the better. I mean, when you go to the IMCAS meeting and hear some of the world hair experts speaking, there seems to be a broad consensus that once a follicle's been dormant for more than 8 years, it's gone. Like, good luck trying to, wake it up again. Because bald people do have hair follicles. You just can't see them because the vellus hair is so fine. So, how do we keep this follicle stimulated and stay in the anagen phase instead of becoming a fine vellus hair? The sooner we get at it, the better. And the more we microneedle it, the better. And the microneedling is, things cost money, is probably the most cost-effective way that we can deliver, treatments. But it has been shown microneedling alone helps hair growth. RF microneedling helps hair growth. Hell, using an erbium YAG laser on your scalp helps hair growth. And we have all these in the office. But of course, if I'm using a machine that costs over 100,000 US, that's going to be a more expensive treatment than a microneedling pen.
Thank you. And so also with, the mask is going to be in the EXO starter kit that everyone's going to be receiving. But one of the questions is, with Fitzpatrick scales, higher Fitzpatrick scales, energy-based devices, the more inflammation we instill into the skin,
Mm,
these masks are really great at cooling down that skin if it's
yes.
refrigerated prior to placing onto the skin. And so with the advent of our retinol boosters that we've discussed in this webinar, how would you determine, when to use those, when not to use those? Is a patient titrated to retinols? Are they super sensitive? Their Fitzpatrick scale? How does all that factor into when you choose to utilize one of those retinol boosters?
I always ask them, do they mind being a little more red? Will they put up like the one picture I showed in the presentation? She was still red on day 5, and that's because she had the retinol used. I mean, if you don't use the retinol, the recovery is much faster because you don't have the retinol on board. So if you think the patient is sensitive to this redness, I wouldn't use the retinol. I would use, for instance, the PX7 exosomes. Do your treatment, whatever that may be, and see how they do. And then the next time you can ask them, hey, how was it? Like, and if they go, oh, that was fine, go, would you mind a little bit of redness on day 3 or 4 with some light exfoliation? We can add retinol to your treatment, or is the patient already retinized because they're already on retinol or retinoic acid, as part of their home care program? Those people, of course, will react less. But in general, like my experience with the 4%, like that goes with the peels, the 4% peel I would do before an 8% peel just to test the patient's tolerability. Many people don't seem to understand the color red, because I mean, I've only done 3 house calls in my life, and they were all chemical peel patients where they called up hyperventilating the next day. I They said they couldn't leave their house. Lucky it was close to my office. I drove there and I brought lorazepam because that's what they needed. They opened the door, their faces are red. There was no evidence of any infection or, a spread of herpes or anything, bad like that. And they just simply, I look at them, what is it about chemical peel you don't understand? Like it's not chemical, nothing happened. Okay. You're going to be a little red. But up here in the, Pacific rainforest, people don't like a lot of redness. So although the retinol works better, I ask every single person, are you willing to be a little red? And I think the best way to test it is to do whatever treatment you're doing without the retinol the first time, unless you really know the patient and they understand, they're going to be a little more red and they're going to get better results.
And now, on for their retinol home care, do they need to stop their retinol home care in any preparation for a microneedling?
People talk about that, and I think that's a medical myth. I
Mm,
think you can use your retinol right up to, like you used it yesterday, come in today for your treatment. I don't know why we have these you know, rules out there. Like, and much of the stuff is being debunked right now. Like recently in the literature, you can see now finally, I mean, I've been doing it for years. Remember, we were told you can't do Accutane and have a laser treatment. I've been doing it honestly for over 2 decades right now. And this came out of the CO2 resurfacing days where people were on high dose Accutane, dried right out, had aggressive CO2 lasering, full field, and then didn't heal very well, because they're dried out. And so now the recommendation comes out you can't have a laser. Really? A non-ablative laser? Like laser hair removal is nothing like a full field CO2. You can't have microneedling? Really? There's no heat even involved. And how aggressive are you with the microneedling, compared to CO2? So, a lot of this stuff has now been, like I say, debunked, with all the myths around Accutane. It causes depression, it causes suicide, it causes this, causes that. It's, you can't laser. And I think it's the same with the topical, retinols as well, with all this
yes.
stuff. I've been
And so,
doing it for years with impunity on skin of color as well.
well, that's good to know, especially as a clinical trainer.
Yeah.
And so, with the stacking, it's so popular to get these stacks, where we're
Yes.
layering these different
Yes.
boosters. And so,
Yes.
PRX8 has a 0.5% of all trans retinol, and then we have the
Mm.
Plant Exosome 4 and 8%. Um, have you stacked those in your practice? I mean, I know I have personally, and I've had practitioners that have. But do you have more insight on that?
Yes, you can stack them again if the person, is willing to be a little more red, and a little more irritated because we're using now 8% retinol, not 0.5%. And I guess your question is, can we microneedle them and then apply the peel, the retinal peel? And the answer is yes. And one can do that with other things too. For example, when we do photodynamic therapy, if someone would like a better treatment or they're not reacting to intact skin, that you simply degreased with alcohol, you can do microneedling and get the AL, the aminolevulinic acid, whether it's Medvix or, Douce's product, Levulan, get it in a little deeper. So we do that all the time. And, you know,
Well, good. And so also to our next questions, there's two attendees that have sort of asked this question. So
mhm.
within College and Penn, we have three possible passes that you can do on any given area, maximum of three. You can go anywhere from 1, 2, 3. You said that you stated that you go the X and Y axis, and that's really all
Yes,
that you need. And so really, because the more passes, I'm assuming, the more trauma, the more
yes.
acute
And this
inflammation.
pen is 3 times the speed of the others because of extra needles and more RPMs. So I find 2 passes sufficient for just skin rejuvenation. However, if we have a person, for example, they have a little bit of acne scarring right here on their cheek, we might be doing their cheek at point 0.5, then we might do 3, 4, 5 passes a little deeper, point 0.8, 1.0, just in the acne area. We ask the patient, do you mind being a little more red over your left cheek? You've got some little scarring there. And, we just ask the patient's permission. The other thing I like doing, just in general, is of course, we keep a record of the depth that we used. And it also depends on the technician as well. If you press harder, that's different than if you have a light touch. So there are some of those factors, but assuming you have the same person doing the treatment, then they know how much pressure they use. Hopefully it's consistent. And then you can ask the patient, okay, how was zero point 0.5 millimeters? Would you like me to go up point 0.1? I can go to point 0.6. I can go to point 0.7. Of course, I'm not going to harm anybody. Um, Des Ferrandes, who was the plastic surgeon from South Africa, I saw him speak, I believe it was in Bangkok once, and he basically is the father of microneedling. And he did a video of himself microneedling his forehead, and he went back and forth in the mirror, like it's actually quite a shocking video, till blood is pouring out of his forehead, actually completely obliterating his eyes. It's quite a gory video that he took. And he did it to show, look how my skin looks. He said, I welcome you all to come down to the stage. And at the time, I think the man was in his 70s. And I went down to the stage to have a good look at him after his talk, and his forehead looked immaculate. And his point was that, look at me, I healed completely well, even though I turned my skin into hamburger meat. I mean, this was, I've never done that to anybody with microneedling, but his point was it is a very, very safe procedure. Like, it's very difficult to screw this up. Okay. And I'm sure someone somewhere is going to screw it up. Humans are great at doing that. But the safety profile is very good. And there's a large therapeutic window there that you have.
Wonderful. And so, as we approach our top of the hour, I want to burn through as many of these questions and get these
Sure.
answers as we can. And so, with the retinol based peels, how soon after we really train that, just to wipe up the skin after the needles come off the skin, and to clean it up with the saline gauze and then to apply the pad?
Yes. Yeah, that would be fine. When I'm using, the only time I don't do that is if I'm using, let's say, the plant-based exosomes as my lubricant. I'm microneedling them in, and then when I'm done, I take the last half a cc, wipe it all over the face. I tell the patient, don't wash your face today. You have good stuff on there that's expensive. And so leave it on and let it absorb. And if you really feel like you want to wash your face before bed, then do so. But you can go to bed with this on. You're fine, you know, and have a clean pillowcase. That's probably the most important thing. Who knows what
Right.
people are sleeping on? And I think that's the most important thing. We disinfected them in the office prior to the treatment. And I tell them all, try to leave the exosomes on all night if you can. Or if you have them, if we send them home with a mask, then you can apply that on yourself, of course, right?
Yes, absolutely. And so, one last one question. It's really going to be about that PRX8. So the retinol.
Yes.
We've verified that they're okay with being read, that
Hmm.
they're in for the post care. I think setting the expectation is the biggest um, principle when
Yes.
we're engaging with these retinol based boosters. And so, with post care, I'll just go ahead and answer this one a little bit. The
Hmm.
retinol, the exosome facial mask is going to be, whether it's cooled prior to placing onto the skin, is really going to be best for cooling down that skin. And we do have arnica hydrocortisone blends as well for that more mature skin that might be prone to bruising. So, but do you have anything to add to that?
No, in a perfect world, we would use an exosome facial mask, on every single treatment. I mean, it's like magic watching the redness dissipate. Like the erythema just goes away. And I mean, and like, listen, we also have a jet peel in our office. I mean, that's a more expensive device. I've had the exosome sprayed into my face, like, afterwards, and the cooling is phenomenal. It's just amazing. I've had treatments like, for example, the Cyton Halo laser. You are very hot. Anyone on this call would know that who's had a halo treatment, especially an aggressive one. And it's amazing how the erythema, the heat, the pain after the treatment just literally magically goes away with the exosomes. You have to try it and see it yourself. They certainly are anti-inflammatory in the immediate post-procedure period, like the first 12 to 24 hours. And then, of course, my hope is, I can't prove it, how much are my fibroblasts now being stimulated to make more collagen and elastin? But even the anti-inflammatory properties that you get in the immediate post-procedure period, I think justifies their use. Because when you
Beautiful.
hurt people, they don't want to do the treatment anymore.
Right.
Or if they
That's a
prolong downtime, and we all know the faster you heal, the less complications we have. So who doesn't want to speed up the healing process? And I don't
think
like this no pain, no gain, beauty is pain. I mean, oh my God. Like, that's what people say because we hurt people. So let's try to mitigate that.
absolutely. And so, one last question, and this is
Hmm?
really just very common with microneedling causing hyperpigmentation.
Yes. I mean, I have not seen it myself. Now, I don't treat a lot of African American skin, but we have a lot of type 5s in Canada. And also, Vancouver is primarily Asian in population, and they have very sensitive skin. And I've not seen PIH from microneedling, but perhaps because we're not super aggressive with it. I've seen PIH with heat-based treatments, yes, but not with microneedling. But like I say, we're not going super aggressive like Des Ferrandes is, who's, by the way, a white man, so of course he can treat his forehead aggressively. It'd really be hard to get PIH in someone who's a Fitz 1 or 2. Yeah. And so almost impossible, probably. So I have not seen it, and the only way you can mitigate PIH is, rapid healing afterwards, which is the exosomes. And exosomes have been shown to help in things like melasma, PIH. I mean, I've seen, different descriptions of that. I've seen it in my own practice.
Yes. And so, that is going to conclude our webinar for tonight. Thank you all for joining us. Do be looking out in your emails for the playback as well as your Exo starter kit. And for that attendee that really liked my skin, it's the Plant Exo Youth Serum. It is fantastic. It's in our Let It Glow Exo kit this season. So do check that out. But thank you all for attending, and be on the lookout for that email containing all of that information, the playback, and those goodies.
Thank you, everyone, for tuning in. And thank you, Induction Therapies. And good luck with your exosomes in the future, all of you. Bye bye.
Thank you,
Thank
Dr.
you.
Braun.
Bye bye.
Bye bye.